Hello, I'm William Tarter Jr. with the Center for Community Solutions, a nonpartisan research and policy institute. Welcome to Human Services 101, a straightforward guide to the social services in Ohio. Our goal through this project is to provide easy to understand, yet comprehensive information on the important social service systems that help Ohioans. In this segment, I'll provide a brief overview of aging services in Ohio. If you want to dig deeper on this issue, check out the complete guide, which includes extra data and graphs, as well as links to other resources. Additional videos on other areas of the human services are also available on our website at www.communitysolutions.com. The growth in the senior population has important implications for health and social service delivery. As they age, older adults face issues that are unique compared to those experienced by other portions of the population. Although public programs like Social Security and Medicare reduce poverty and make essentials such as healthcare more readily accessible, disability, chronic disease, elder abuse and neglect, as well as accessible and affordable housing pose distinct challenges. In Ohio, adults aged 60 and over currently make up about 20% of the state's population. By 2030, this demographic group is projected to have grown to 29% of the population. As people age, they may become unable to care for themselves or protect themselves from a variety of forms of abuse, including neglect, financial exploitation, and physical, emotional, or sexual abuse. The Ohio Department of Job and Family Services oversees the Adult Protective Services program for the state, which helps protect seniors aged 60 and over who may be vulnerable to abuse. Reports of elder abuse are investigated by county agencies, most often departments of Job and Family Services. Reports of abuse can be submitted to that local Department of Job and Family Services in the county where the adult lives, or where the incidents of abuse occurred. In counties without a 24-hour hotline, local law enforcement agencies should be contacted if abuse occurs outside of business hours. From July 2013 to July 2014, Ohio received 13,151 reports of abuse, neglect, and exploitation for older adults over the age of 60. In 2014, 8% of Ohioans over age 65 had a self-care disability, and nearly 15% had an independent living difficulty. For seniors who can no longer live in their communities, institutional settings such as nursing homes are available. However, nursing facilities can be expensive. For older adults who qualify, Medicaid serves as a payer for long-term care services. If the older adults do not wish to receive long-term care in an institutional setting and would like to remain in the community, several types of Medicaid waivers are available. A waiver allows older adults to waive their rights to institutional care in favor of services in a home or community-based setting. One well-known Medicaid waiver for seniors is the pre-admission screening system providing options and resources today, or Passport program, which includes adult day programs, accessibility adaptations, home-delivered meals, medical equipment and supplies, personal care services, and transportation assistance. Area agencies on aging were created by the National Older Americans Act in 1965. In Ohio, there are 12 area agencies on aging, which are overseen by the Ohio Department of Aging. They are regional organizations that advocate, plan, educate, and fund services to meet the needs of older adults in their communities. Area agencies on aging manage federal, state, and local funds for aging services, partnering with direct service organizations to provide in-home and community-based services. Other services include assessments, case management, referrals to providers, and educational trainings. Thank you for taking the time to learn about aging services in Ohio. For more information, or to view videos on other areas of the human services, visit our website at www.communitysolutions.com.